A nurse in the emergency department's observing a 1-year-old child for signs of increased intracranial pressure after a fall from a bicycle, resulting in head trauma. Which of the following signs or symptoms would be cause for concern? A. Bulging anterior fontanelle. B. Repeated vomiting. C. Signs of sleepiness at 10 p.m. D. Inability to read short words from a distance of 18 inches. Answer B. Repeated vomiting. Rationale: increased pressure caused by bleeding or swelling within the skull can damage delicate brain tissue and may become life-threatening. Repeated vomiting. Be an early sign of pressure as the vomit center within the medulla is stimulated. The anterior fontanelle is closed in a 4-year-old child. Evidence of sleepiness at 10 p.m. is normal for a 4-year-old. The average 4-year-old child cannot read yet, so D option is normal. A non-immunized child appears at the clinic with a visible rash. Which of the following observations indicates the child may have rubeola, measles? A. Small blue-white spots are visible on the oral mucosa. B. The rash begins on the trunk and spreads outward. C. There is low-grade fever. D. The lesions have a teardrop on a rose petal appearance. Rationale: complex spots are small blue-white spots visible on the oral mucosa and are characteristic of measles infection. The body rash typically begins on the face and travels downward. High fever is often present. Teardrop on a rose petal refers to lesions found in varicella chickenpox. A child is seen in the emergency department for scarlet fever. Which of the following descriptions of scarlet fever is not correct? A. Scarlet fever is caused by infection with group A Streptococcus bacteria. B. Strawberry tongue is a characteristic sign. C. Petechia occur on the soft palate. D. The pharynx is red and swollen. Answer: C. Petechia occur on the soft palate. Rationale: petechia on the soft palate are characteristics of rubella infection. Choices A, B, and D are characteristic of scarlet fever, a result of group A Streptococcus bacteria. The mother of a 2-month-old infant brings the child to the clinic for a well baby check. She is concerned because she feels only one testis in the scrotal sac. Which of the following statements about the undescended testis is the most accurate? A. Normally, the testes are descended by birth. B. The infant will likely be required surgical intervention. C. The infant probably has with only one testis. D. Normally, the testes descend by 1 year of age. Answer: D. Normally, the testes descend by 1 year of age. Rationale: normally, the testes descend by 1 year of age. In young infants, it is common for the testes to retract into the inguinal canal when the environment is cold or the cremasteric reflex is stimulated. Exam should be done in a warm room with warm hands. It is most likely that both testes are present and will descend by a year. If not, a full assessment will determine the appropriate treatment. A child weighing 30 kilograms arrives at the clinic with diffuse itching as the result of an allergic reason to an insect bite. Diphenhydramine Benadryl 25 mg 3 times a day is prescribed. The correct pediatric dose is 5 milligrams per kilogram per day. Which of the following best describes the prescribed drug dose? A. It is the correct dose. B. The dose is too low. C. The dose is too high. D. The dose should be increased or decreased depending on the symptoms. Answer: B. The dose is too low. Rational. This child weighs 30 kilograms, and the pediatric dose of diphenhydramine is 5 milligrams per kilogram per day. 5x30 equals 150 per day. Therefore, the correct dose is 150 milligrams per day. Divided into 3 doses per day, the child should receive 50 milligrams 3 times a day rather than 25 milligrams 3 times a day. Dosage should not be titrated based on symptoms without consulting a physician. The nurse has provided dietary instructions to the mother of a child with celiac disease. The nurse determines that the mother understands the instructions when the mother states to include which food in the child's diet. 1. Corn. 2. Wheat cereal. 3. Rye crackers. 4. Oatmeal biscuits. Answer 1. Corn. Rationale. Dietary management is the mainstay of treatment in celiac disease. All wheat, rye, barley, and oats should be eliminated from the diet and replaced with corn and rice. Vitamin supplements, especially fat-soluble vitamins and folate, may be needed in the early period of treatment to correct deficiencies. These are likely to be lifelong restrictions, although small amounts of grains may be tolerated after the ulcerations have healed. Which question should the nurse ask the parents of a child suspected of having glomerulonephritis? 1. Did your child fall off a bike onto the handlebars? 2. Has the child had persistent nausea and vomiting? 3. Has the child been itching or had a rash any time in the last week? 4. Has the child had a sore throat or a throat infection in the last few weeks? Answer 4. Has the child had a sore throat or a throat infection in the last few weeks? Rationale. Glomerulonephritis refers to a group of kidney disorders characterized by inflammatory injury in the glomerulus. Group A beta hemolytic streptococcal infection is a cause of glomerulonephritis. Often, a child becomes ill with streptococcal infection of the upper respiratory tract and then develops symptoms of acute post-streptococcal glomerulonephritis after an interval of 1 to 2 weeks. The assessment data in options 1, 2, and 3 are unrelated to a diagnosis of glomerulonephritis. The mother of a 6-year-old child who has type 1 diabetes mellitus calls a clinic nurse and tells the nurse that the child has been sick. The mother reports that she checked the child's urine and it was positive for ketones. The nurse should instruct the mother to take which action? 1. Hold the next dose of insulin. 2. Come to the clinic immediately. 3. Encourage the child to drink liquids. 4. Administer an additional dose of regular insulin. Answer 3. Encourage the child to drink liquids. Rationale. When the child is sick, the mother should test for urinary ketones with each voiding. If ketones are present, liquids are essential to aid in clearing the ketones. The child should be encouraged to drink liquids. Bringing the child to the clinic immediately is unnecessary. Insulin doses should not be adjusted or changed. Oral iron is prescribed for a child with iron deficiency anemia. The nurse provides instructions to the mother regarding the administration of the iron. The nurse should instruct the mother to administer the medication in which way? 1. Between meals. 2. Just before a meal. 3. Just after the meal. 4. With a fruit low in vitamin C. Answer 1. Between meals. Rationale. The mother should be instructed to administer oral iron supplements between meals. The iron should be given with a citrus fruit or juice high in vitamin C because vitamin C increases the absorption of iron by the body. The student nurse is caring for an infant with a tracheostomy and is preparing to suction the infant. The nursing instructor should intervene if the nursing student stated she would take which action to perform this procedure. 1. Limit insertion and suctioning time to 15 seconds to prevent hypoxia. 2. Insert the catheter the length of the tracheostomy tube with a suction off. 3. Apply intermittent suction and withdraw the catheter with a twisting motion. 4. Reoxygenate between suction catheter passage and allow sufficient recovery time with each pass. Answer 1. Limit insertion and suctioning time to 15 seconds to prevent hypoxia. Rationale: when suctioning a tracheostomy in an infant, it is necessary to limit insertion and suctioning time to 5 seconds to prevent hypoxia. Correct suctioning procedures for an infant include inserting the catheter the length of the tracheostomy tube with a suction off, applying intermittent suction and withdrawing the catheter with a twisting motion, and reoxygenating between suction catheter passage. Nursing care of the child with myelosuppression from leukemia or chemotherapeutic agents should include which intervention? 1. Restrict oral fluids. 2. Use good hand washing technique. 3. Give immunizations appropriate for age. 4. Institute strict isolation with no visitors allowed. Answer 2. Use good hand washing technique. Rationale: a child with myelosuppression is at risk for infection. Good hand washing technique is necessary to prevent the spread of infection. Restricting oral fluids would not be an intervention to reduce the risk of infection and could actually be harmful to the child. Live virus vaccines are not given when the child is myelosuppressed. So assessment of the child's immune status should be done before administration of immunizations appropriate for age. Strict isolation without visitors is not warranted, although visitors should wear a mask and gloves while in the child room. The nurse is providing home care instructions to the parents of a 10-year-old child with hemophilia. Which sport activity should the nurse suggest for this child? 1. Soccer. 2. Basketball. 3. Swimming. 4. Field hockey. Answer 3. Swimming. Rationale: hemophilia refers to a group of bleeding disorders resulting from a deficiency of specific coagulation proteins. Children with hemophilia need to avoid contact sports and to take precautions such as wearing elbow and knee pads and helmets with other sports. The safe activity for them is swimming. A new parent expresses concern to the nurse regarding sudden infant death syndrome, SIDS. She asks the nurse how to position her new infant for sleep. In which position should the nurse tell the parent place the infant? 1. Side or prone. 2. Back or prone. 3. Stomach with the face turned. 4. Back rather than on the stomach. Answer 4. Back rather than on the stomach. Rationale: SIDS is the unexpected death of an apparently healthy infant younger than 1 year for whom an investigation of the death and a thorough autopsy failed to show an adequate cause of death. Several theories are proposed regarding the cause, but the exact cause is unknown. Nurses should encourage parents to place the infant on the back supine for sleep. Infants in the prone position on the stomach may be unable to move their heads to the side, increasing the risk of suffocation. The infant may have the ability to turn to a prone position from the side lying position. The nurse notes that an infant with the diagnosis of hydrocephalus has a head that is heavier than that of the average infant. The nurse should determine that special safety precautions are needed when moving the infant with hydrocephalus. Which statement should the nurse plan to include in the discharge teaching with the parents to reflect this safety need? 1. Feed your infant in a side-lying position. 2. Place a helmet on your infant when in bed. 3. Hyperextend your infant's head with a rolled blanket under the neck area. 4. When picking up your infant, support the infant's neck and head with the open palm of your hand. Answer 4. When picking up your infant, support the infant's neck and head with the open palm of your hand. Rationale Hydrocephalus is a condition characterized by an enlargement of the cranium because of an abnormal accumulation of cerebrospinal fluid in the cerebral ventricular system. This characteristic causes the increase in the weight of the infant's head. The infant may experience significant head enlargement. Care must be exercised so that the head is well supported when the infant is fed or moved to prevent extra strain on the infant's neck. And measures must be taken to prevent the development of pressure areas. Supporting the infant's head and neck when picking up the infant will prevent the hyperextension of the neck area and prevent the infant from falling backward. The infant should be fed with the head elevated for proper motility of food processing. A helmet could suffocate an unattended infant during rest and sleep times. And hyperextension of the infant's head could put pressure on the neck vertebrae, causing injury. The nurse analyzes the laboratory values of a child with leukemia who is receiving chemotherapy. The nurse notes that the platelet count is 19,500 cubic millimeters, 19.5 times 109 per liter. On the basis of this laboratory result, which intervention should the nurse include in the plan of care? 1. Initiate bleeding precautions. 2. Monitor closely for signs of infection. 3. Monitor the temperature every 4 hours. 4. Initiate protective isolation precautions. Answer 1. Initiate bleeding precautions. Rationale Leukemia is a malignant increase in the number of leukocytes, usually at an immature stage, in the bone marrow. It affects the bone marrow, causing anemia from decreased erythrocytes, infection from neutropenia, and bleeding from decreased platelet production, thrombocytopenia. If a child has a low platelet count, usually less than 50,000 cubic millimeters, 50.0 times 109 per liter, bleeding precautions need to be initiated because of the increased risk of bleeding or hemorrhage. Precautions include limiting activity that could result in head injury, using soft toothbrushes, checking urine and stools for blood, and administering stool softeners to prevent straining with constipation. In addition, suppositories, enemas, and rectal temperatures are avoided. Options 2, 3, and 4 are related to the prevention of infection rather than bleeding. The clinic nurse is reviewing the primary healthcare provider's prescription for a child who has been diagnosed with scabies. Lindane has been prescribed for the child. The nurse questions the prescription, if which is noted in the child record. 1. The child is 18 months old. 2. The child is being bottle fed. 3. A sibling is using Lindane for the treatment of scabies. 4. The child has a history of frequent respiratory infection. Answer 1. The child is 18 months old. Rationale Lindane is a pediculicide product that may be prescribed to treat scabies. It is contraindicated for children younger than 2 years because they have more permeable skin and high systemic absorption may occur, placing the children at risk for central nervous system toxicity and seizures. Lindane also is used with caution in children between the ages of 2 and 10 years. Siblings and other household members should be treated simultaneously. Options 2 and 4 are unrelated to the use of Lindane. Lindane is not recommended for use by a breastfeeding woman because the medication is secreted into breast milk. The nurse is caring for 4 pediatric clients. After receiving reports from the night shift, which child should the nurse assess first? 1. A 6-year-old child being treated for bacterial meningitis and on the 10th day of antibiotic treatment. 2. A 6-week-old infant admitted to the hospital for decreased level of consciousness. Shaken baby syndrome is suspected. 3. A 2-year-old child with cerebral palsy being admitted to the hospital for surgical placement of a gastrostomy feeding tube the next day. 4. A 16-year-old child with a ventriculoperitoneal shunt that was placed at birth for hydrocephalus. Possible shunt malfunction is suspected, and the child is scheduled and ready for a computed tomography (CT) scan of the head. Answer 2. A 6-week-old infant admitted to the hospital for decreased level of consciousness. Shaken baby syndrome is suspected. Rationale. The infant or child who is the most unstable should be assessed first. A 6-week-old infant with an altered level of consciousness suspected to have resulted from shaken baby syndrome is the most unstable client because the infant could be developing increased intracranial pressure (ICP) and require interventions for the complications associated with increased ICP. The 6-year-old child on day 10 of antibiotics for bacterial meningitis is a stable client. The 2-year-old child with cerebral palsy being admitted for surgical placement of a gastrostomy tube will need an admission assessment, but this child is stable. The 16-year-old with a possible shunt malfunction could become unstable because this child is older and ready for the CT scan. He or she is stable at this time. A 10-year-old child complains of ear pain that is aggravated by palpation of the auricle. A foul-smelling, tenacious yellow discharge is noted in the ear canal, and the child is diagnosed with acute otitis externa. In providing information to the child and parent, the nurse emphasizes which information. 1. Dizziness is common with this disorder. 2. Cotton-tipped applicators should be used to clean the ears. 3. Nothing smaller than the child's elbow should be placed in the ear. 4. Biannual ear testing must be done by a special primary health care provider. Answer 3. Nothing smaller than the child's elbow should be placed in the ear. Rationale. The nurse should provide information about ear care to children because it is not uncommon for them to put sharp or small objects, such as cotton swabs, into their ears, and these behaviors can cause injury. A face cloth on a fingertip is safe to use for ear cleaning. Acute otitis externa may cause a low-pitched tinnitus but usually does not cause dizziness unless the condition has progressed to an otitis media. Audiography is performed during a screening done at school, usually every year, and does not necessarily need to be performed by a special primary health care provider. The nurse is planning care for a child with acute bacterial meningitis. Based on the mode of transmission of this infection, which precautionary intervention should be included in the plan of care? 1. Maintain enteric precautions. 2. Maintain neutropenic precautions. 3. No precautions are required as long as antibiotics have been started. 4. Maintain respiratory isolation precautions for at least 24 hours after the initiation of antibiotics. Answer 4. Maintain respiratory isolation precautions for at least 24 hours after the initiation of antibiotics. Rationale. Meningitis is an infectious process of the central nervous system caused by bacteria and viruses. It may be acquired as a primary disease or as a result of complications of neurosurgery, trauma, infection of the sinus or ears, or systemic infections. A major priority of nursing care for a child suspected to have meningitis is to administer the antibiotic as soon as it is prescribed. The child also is placed on respiratory isolation precautions for at least 24 hours while culture results are obtained and the antibiotic is having an effect. Enteric precautions and neutropenic precautions are not associated with the mode of transmission of meningitis. Enteric precautions are instituted when the mode of transmission is through the gastrointestinal tract. Neutropenic precautions are instituted when a child has a low neutrophil count. A child with rubeola, measles, is being admitted to the hospital. In preparing for the admission of the child, the nurse should plan to place the child on which precautions? 1. Enteric 2. Airborne 3. Protective 4. Neutropenic. Answer 2. Airborne. Rationale. Rubiola is transmitted via airborne particles or direct contact with infectious droplets. Airborne droplet precautions are required, and persons in contact with the child should wear masks. The child is placed in a private room if hospitalized, and the hospital room door remains closed. Gowns and gloves are unnecessary, but standard precautions are used. Articles that are contaminated should be bagged and labeled. Special enteric precautions and protective neutropenic isolation are not indicated in rubiola. A 2-year-old child is treated in the emergency department for a burn to the chest and abdomen. The child sustained the burn by grabbing a cup of hot coffee that was left on the kitchen counter. The nurse reviews safety principles with the parents before discharge. Which statement by the parents indicates an understanding of measures to provide safety in the home? 1. We will be sure not to leave hot liquids unattended. 2. I guess our children need to understand what the word hot means. 3. We will be sure that the children stay in their rooms when we work in the kitchen. 4. We will install a safety gate as soon as we get home so that children cannot get into the kitchen. Answer 1. We will be sure not to leave hot liquids unattended. Rationale: toddlers with their increased mobility and development of motor skills can reach hot water or hot objects placed on counters and stoves, and can reach open fires or stove burners above their eye level. The nurse should encourage parents to remain in the kitchen when preparing a meal. Use the back burners on the stove and turn pot handles inward and toward the middle of the stove. Hot liquids should never be left unattended or within the child's reach, and the toddler should always be supervised. The statements in options 2, 3, and 4 do not indicate an understanding of the principles of safety. The nurse is providing home care instructions to the mother of a 9-year-old child diagnosed with bacterial conjunctivitis. Topical antimicrobial therapy is prescribed for the child. Which statement by the mother indicates that teaching has been effective? 1. My child cannot return to school until seen by the pediatrician in 1 month. 2. My child can return to school immediately because my child is not contagious. 3. My child needs to stay at home from school for at least 3 weeks to complete the entire prescription of eye drops. 4. My child will need to stay home from school until my child has received the eye medication for at least 24 to 48 hours. Answer 4. My child will need to stay home from school until my child has received the eye medication for at least 24 to 48 hours. Rationale: bacterial conjunctivitis is extremely contagious. The child should be kept home from school or daycare until the child has received topical antimicrobial therapy for 24 to 48 hours per pediatrician prescription. The remaining options are incorrect. The child is not required to stay out of school for 3 weeks to 1 month. This condition is highly contagious during the first 24 to 48 hours, and therefore the child should not return to school immediately. The mother of a 3-year-old asks a clinic nurse about appropriate and safe toys for the child. The nurse should tell the mother that the most appropriate toy for a 3-year-old is which? 1. A wagon. 2. A golf set. 3. A farm set. 4. A jack set with marbles. Answer 1. A wagon. Rationale: toys for the toddler must be strong, safe, and too large to swallow or place in the ear or nose. Toddlers need supervision at all times. Push-pull toys, large balls, large crayons, large trucks, and dolls are some of the appropriate toys. A farm set, a golf set, and jacks with marbles may contain items that the child could swallow. The nurse is assigned to care for an 8-year-old child with a diagnosis of a basilar skull fracture. The nurse reviews the primary healthcare provider's PHCP's prescriptions and should contact the PHCP to question which prescription. 1. Obtain daily weight. 2. Provide clear liquid intake. 3. Nasotracheal suction as needed. 4. Maintain a patent intravenous line. Answer 3. Nasotracheal suction as needed. Rationale: a basilar skull fracture is a type of head injury. Nasotracheal suctioning is contraindicated in a child with a basilar skull fracture. Because of the nature of the injury, there's a possibility that the catheter will enter the brain through the fracture, creating a high risk of secondary infection. Fluid balance is monitored closely by daily weight determination, intake and output measurement, and serum osmolality determination to detect early signs of water retention, excessive dehydration, and states of hypertonicity or hypotonicity. The child is maintained on NPO, nothing by mouth status, or restricted to clear liquids until it is determined that vomiting will not occur. An intravenous line is maintained to administer fluids or medications, if necessary. The nurse receives a telephone call from the admissions office and is told that a child with acute bacterial meningitis will be admitted to the pediatric unit. The nurse prepares for the child's arrival and plans to implement which type of precautions? 1. Enteric. 2. Contact. 3. Droplet. 4. Neutropenic. Answer 3. Droplet. Rationale: a major priority in nursing care for a child with suspected meningitis is to administer the appropriate antibiotic as soon as it is prescribed. The child will be placed in a private room with droplet transmission precautions for at least 24 hours after antibiotics are given. Enteric contact and neutropenic precautions are not associated with the mode of transmission of meningitis. Enteric precautions are instituted when the mode of transmission is through the gastrointestinal tract. Contact precautions are instituted when contact with infectious items or materials is likely. Neutropenic precautions are instituted when the client has a low neutrophil count. The nurse instructs the parents of a child with leukemia regarding measures related to monitoring for infection. Which statement, if made by the parent, indicates a need for further instructions? 1. I will take a rectal temperature daily. 2. I will inspect the skin daily for redness. 3. I will inspect the mouth daily for lesions. 4. I will perform proper hand washing techniques. Answer 1. I will take a rectal temperature daily. Rationale: leukemia is a malignant increase in the number of leukocytes, usually at an immature stage, in the bone marrow. The risk of injury to fragile mucous membranes and resultant bleeding is so high in the child with leukemia that tympanic or axillary temperatures should be taken. In addition, rectal abscesses can occur easily to damage rectal tissue. No rectal temperatures should be taken. In addition, oral temperature taking should be avoided, especially if the child has oral ulcers. All other options are appropriate measures to prevent infection. Which car safety device should be used for a child who is 8 years old and 4 feet tall? 1. Seat belt. 2. Booster seat. 3. Rear-facing convertible seat. 4. Front-facing convertible seat. Answer 2. Booster seat. Rationale: all children whose weight or height is above the forward-facing limit for their car safety seat should use a belt positioning booster seat until the vehicle seat belt fits properly. Typically, one may have reached 4 feet 9 in height, 145 centimeters, and are between 8 and 12 years of age. Infants should ride in a car in a semi-reclined, rear-facing position in an infant-only seat or a convertible seat until they weigh at least 20 pounds (9 kilograms) and are at least 1 year of age. The transition point for switching to the forward-facing position is defined by the manufacturer of the convertible car safety seat but is generally at a body weight of 20 pounds (9 kilograms) and 1 year of age. In evaluating an infant's physical status and growth, the nurse expects to find A. Birth weight triples by 6 months, B. Anterior frontal closes 4 to 8 weeks after birth, C. Chest circumference is a larger than head circumference at 12 months, D. Birth height increases 1 inch each month for the first 6 months. Answer: D. Birth height increases 1 inch each month for the first 6 months. Rationale: birth weight double by 6 months, triples by 12 months. Anterior frontal closes 12–18 months after birth. Chest circumference is equal to head circumference at 12 months. An alert child who is crying loudly is brought to the hospital emergency department for a simple fracture to the lower right arm that occurred after a fall off a bicycle. What is the nurse's priority assessment? 1. Mobility. 2. Skin integrity. 3. Neurovascular. 4. Level of consciousness. Answer: 3. Neurovascular. Rationale: a simple fracture is a fracture of the bone across its entire shaft with some possible displacement but without breaking the skin. The priority assessment is the neurovascular status in the affected arm. The affected arm should be immobilized. Skin integrity is a higher priority in a compound fracture since there is an open wound. The level of consciousness is already established as the child is alert and crying. A preschooler with a history of cleft palate repair comes to the clinic for a routine well-child checkup. To determine if this child is experiencing a long-term effect of cleft palate, which question should the nurse ask? 1. Was the child recently treated for pneumonia? 2. Does the child play with an imaginary friend? 3. Is the child unresponsive when given directions? 4. Has the child had any difficulty swallowing food? Answer: 3. Is the child unresponsive when given directions? Rationale: unresponsiveness may be an indication of hearing loss. A child who has a history of cleft palate should be routinely checked for hearing loss. Pneumonia and dysphagia are unrelated to cleft palate after repair. Having an imaginary friend is normal behavior for a preschool child. Many preschoolers with vivid imaginations have imaginary friends.